Blair, and I'm going to be doing my presentation of the National Patient Safety Goals on hand hygiene today. The purpose of the National Patient Safety Goals is to improve patient safety. The goals focus on problems in healthcare safety and how to solve them. According to the 2016 National Patient Safety Goals, hand hygiene is a main concern in today's healthcare, and goals should be implemented to improve hand cleaning. Also, the use of hand cleaning guidelines from the Centers of Disease Control and Prevention and the World Healthcare Organization should be used in the healthcare setting. The importance of hand hygiene. Hospital-acquired infections, or HAIs, are a serious and persistent problem in healthcare. They burden patients, they make for a longer hospital stay, they increase cost, and can be life-threatening to many patients. Microorganisms on healthcare workers' hands can contribute to the incidence of infections. By educating the staff, we can help to reduce the rate of infection and control the compliance among staff. Here's a scenario for you. Jill is a nurse on a medical surgical unit. She is up to date on all of the current guidelines put out by the World Healthcare Organization and the CDC, but reminders are not posted in her unit. She has a team of 6 patients, so she has a full load, one of which has Clostridium difficile, which is a bacteria. After going into the room with contact precautions, Jill uses the antibacterial hand sanitizer as she leaves the room. There is not a sink available for her to wash her hands. So she immediately is called into another patient's room before she can wash her hands. A few days later, her clean patient, the patient that did not have Clostridium difficile, contracts the disease, and she must undergo IV antibiotics and have a longer hospital stay. So, what could Jill have done differently? She could have washed her hands. So, to support the resources, or to support the claims that hand hygiene works, the first article is a study that was done in Africa. The objective of the study was to identify the factors associated with noncompliance among medical doctors and nurses, and to promote the adoption of the recommendations of the WHO guidelines, and to evaluate the compliance among staff members. So what were some of the things that they did? They initiated and executed the WHO recommendation activities for implementation of intervention. So this involved putting strategies in place that promoted hand hygiene compliance. So they did training and education among the staff. They placed reminders in the units that reminded the staff to wash their hands. The second thing, they placed the reminders. This was anywhere from posters to screensavers on the computers that basically reminded nurses, doctors, any medical staff entering patients' rooms that they needed to wash their hands. They introduced an alcohol hand rub. So hundreds of isopropyl alcohol hand rub was strategically placed throughout the units in the hospital. And the trained observers monitored the uses of the hand rubs and ensured prompt replacements if they became empty. The outcomes of this study suggested that the hand hygiene campaign can be successfully executed in a health facility with improvement in the knowledge and attitudes of healthcare workers. The post-intervention hand hygiene overall compliance was 65.3%. So this article improves the goal by using education techniques and reminders to achieve the goal of hand hygiene. In the second article, areas that have emerged as important to advancing science include improved product formulations, use of technology, monitoring hand hygiene, and more rigorous adoption of hand hygiene practices across healthcare. So this is what they did. They did a product formulation and testing. They basically took the current practices and how they were doing them and basically made them better, I guess. So they did observation as well. They had people who were trained in hand hygiene techniques to observe nurses and medical staff coming in and out of the hospital or in and out of the patient's rooms, and would monitor how much they washed their hands, how much they did the alcohol rub, and then they did the impact of practice setting. So more attention should be paid to hand hygiene practices among different patient populations, and especially in pediatrics and geriatrics. Patient hand hygiene. This is a big one because it's always talking about how nurses and medical staff should wash their hands, but we never educate our patients on their importance of washing their hands. So anytime if they have pneumonia or something like Clostridium difficile, every time they go to the bathroom, they need to be washing their hands. If they come in contact with something, and as well as family members coming in and out of the rooms, using the hand sanitizers, washing their hands, that cuts down on the rate of infection as well. So this article improves the goal by implementing new practices and techniques. In the third article, its purpose was to investigate a new patient hand hygiene protocol designed to reduce hospital-acquired infection rates and improve nurses' hand washing compliance in an intensive care unit. So in this study, ICU nurses were required to attend a 10-week protocol training, which basically made them reiterate like why it's important to wash your hands, the proper technique for washing your hands, and made them practice it over and over and over again. This way, the people conducting the study was able to make sure that the staff knew what they were doing before they just let them out into the study. Also, a electronic medical record alert was created to trigger a timely reminder to perform this hand washing technique 3 times a day. So when nurses would be charting, an alert would pop up telling them, hey, you need to wash your hands. So at the conclusion of the study, nurses' hand washing compliance when entering the patient's room increased from 35 to 66% during the study period. Nurses' hand washing compliance when exiting the patient's room improved from 66 to 79%. Before the protocol was implemented, the focus was on washing hands as the nurses left the patient's room, protecting themselves. But after the study, it shifted the nurses' focus to protecting their patients. Because not only is it protecting you as a nurse when washing your hands, but it's also protecting your patients from you spreading something that somebody else may have. And that's it.